with your lumbar flexion. I'm going to measure your range of motion. So I'm finding the iliac crest and I'm placing the fulcrum there. And then I'm lining up the moving arm with the axillary right here. And I'm going to find his ASIS and his PSIS. And I'm going to move the stationary arm to be centered in between those. And he's starting at about 160. So go ahead and try and touch your toes. And I'm moving this to stay in between. And now he's at 150. So that's about 50 degrees of motion. And then we did his right side for the active range of motion for lumbar flexion. So now I'm going to do his left side to compare bilaterally. So I'm going to find the iliac crest for the fulcrum. And find his ASIS and his PSIS. And move this in the middle. And then the moving arm is lined up with axillary. He's at about 170. Go ahead and move forward. Keep moving this to stay in line. And he's at 150. So the same as the other side. Okay, so now I'm going to test the anterior rotation guide of the innominate on his right side. So he's going to be side laying with his knees bent like this. And then go ahead and lay on your chest, but stay laying on your side. Okay. I'm going to take his bottom leg and I'm going to hook it on my hip. And then I'm going to find his PSIS and lean right there and then take my other arm and hook it under. And I'm going to bring it into extension and find the infeel. And it's a firm infeel. So we tested the right side and now we're going to compare bilaterally to his left side. So go ahead and lay on your chest but stay on your side down here. Okay, and I'm going to take this bottom leg and hook it onto my hip. And I'm going to find his PSIS and lean on it and then hook my arm under, push it into extension and find the infeel, and it's still firm. Okay, so now I'm going to do a manual muscle test for grade 3 lumbar rotation. So I'm going to stabilize your feet and you're going to bring this shoulder to this knee with both shoulders off the bed. Okay, back down. And then again with the other side. Okay, good job. Okay. So we're going to be performing the squeeze test, and the specificity of this test is good for ruling in a pathology. So this is generally a pubic pathology or some kind of muscle dysfunction. So you're going to have the patient lie supine with their knees bent at an angle like this. And I'm going to put 2 fists in between and go ahead and squeeze lightly. Do you feel any pain?
No.
Keep squeezing harder.
No.
No pain at all?
No.
As hard as you can? No pain?
No.
Okay, so there's not a positive test. So we're going to do the slump test, and this is good for ruling out any disc pathology with the sensitivity level on this test. So you're going to have your patient start sitting straight up, and then can you flex your shoulders and your back for me and keep your head up straight? And I'm going to put pressure right here. Do you have any pain?
No.
Okay, can you put your chin to your chest? Any pain?
No.
Okay, then I'm going to add pressure right here. Any pain?
No.
Okay, can you extend this knee all the way? I'm still putting pressure. Any pain?
No.
And then I'm going to dorsiflex.
Yes.
Okay, and then do this leg, same thing. Any pain?
Yes.
Okay, so he obviously has some sort of disc pathology that I would refer him to a physician for. Okay, so I'm going to be palpating the quadratus lumborums. I'm going to start off the iliac crest a little laterally, and then I'm going to go up a little, and I'm going to have you lift your chest up off the, okay, and then I can feel the muscles contract, and then while it's up, can you bend to the right? I can feel this one contract and this one relax. Can you go to the other side? And same on the other side. Now I'm going to palpate the inguinal ligament, and I'm just going to start around the iliac crest and then work my way down, and it's into the groin area.